Okay, good afternoon, everyone, and thank you for joining today's COVID-19 update in North Carolina. As of today, North Carolina has had 764,228 confirmed cases, 2,926 new cases reported since yesterday, 2,741 people in the hospital, and sadly, 9,409 people who've died. We're praying for those who are fighting this virus and those who've lost loved ones and friends to COVID-19. Today, we continue to see stabilization in our COVID numbers. The number of hospitalizations has dropped for 8 straight days, along with decreases in our confirmed cases and percent positives. Although these numbers are still too high, we are encouraged. Still, we must not let our guard down, and we all need to wear masks and practice social distancing anytime we leave our homes. Protecting public health has been the top priority since the start of this pandemic. We've taken decisive action to put strong safety protocols in place, including in our schools. When the pandemic first hit in March, we moved to remote instruction to keep people safe from this virus that we knew little about. We asked science and public health experts to develop safety plans to help students continue learning, whether they were in the classroom or at home. Learning has continued. Educators, parents, and students have persevered. We've learned much more about this virus. And now it's time to get our children back into the classroom. Protecting the health and safety of the people of this state, especially our children and our teachers, has been our goal. And since North Carolina went to all remote instruction at the beginning of this pandemic, our number one priority has been getting our children safely back into the classroom. We know school is important for reasons beyond academic instruction. School is where students learn social skills, get reliable meals, and find their voices. And teachers and staff play an important role in keeping students safe by identifying cases of abuse, hunger, homelessness, and other challenges that students face outside of school. At least 90 of our 115 school districts are doing just that by providing in-person instruction for some or all of our students right now. What's new is that research done right here in North Carolina tells us that in-person learning is working and that students can be in classrooms safely with the right safety protocols in place. Today, I'm joined by our state education leaders to strongly urge that all schools provide in-person learning for their students. In addition, it's critically important that these schools strictly follow the safety protocols laid out by the Department of Health and Human Services. That guidance reinforces the importance of in-person learning while maintaining strong public health measures to protect students, teachers, staff, and families. Students should still have the option of remote learning the school year if that's best for them. And the teachers who are at risk should be providing that remote instruction. But students who are ready to return to the classrooms should have that chance. This pandemic has tested us in different ways. But our educators and school staff have never stopped showing up for our students. Our teachers have worked to engage our students, whether remotely or in person. Our custodial staff has worked to keep schools clean and safe. Our bus drivers have gotten meals to students and taken them to and from school safely. I know how hard you're working and that your state appreciates deeply your extraordinary service. Parents deserve a lot of credit right now too, and I thank them. We know they've served as teacher assistants at home on top of their jobs and other responsibilities. And our students have worked hard to learn amid unprecedented challenges. I'm so grateful for the way people have stepped up for our schools. Our team and health officials have worked closely with the Department of Public Instruction and Superintendent Catherine Truitt, and the State Board of Education and its chairman, Eric Davis. We're committed to working together on this, and you will hear from them in a moment. But first, I want to recognize Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services. Dr. Cohen.